In the heart of a busy emergency department, Nurse Sarah meets Emily, a 26-year-old woman brought in after a car accident. Though her physical injuries are minor, Emily's breathing is rapid and she's trembling with anxiety. To calm her, Nurse Sarah introduces herself.
Hi, I'm your Nurse Sarah. I promise you're going to be okay.
Nurse Sarah assesses Emily.
I'm scared. I know. Am I ever going to be able to drive again? Yes, you will, I promise. Okay. Okay, everything sounds good. You're going to be fine, I promise. Okay.
Emily expresses her concerns about her car and the wreck.
I can't believe my car flipped like that.
Nurse Sarah reassures Emily that her wounds are minor.
Everything's minor. You're going to be okay, I promise. Thank you.
Emily's breathing continues rapidly and her heart rate is high. Nurse Sarah tells Emily how to control her breathing.
Hey, slow your breathing down. There you go.
Nurse Sarah reassures Emily that she's in good hands and that she's there with her.
I promise you're going to be okay. You're safe. Thank you.
The video that you just watched explains Hilda Paplou's interpersonal relationships theory and how it transforms nursing from task-focused care to collaborative therapeutic relationships. It highlights Paplou's belief that nursing is an interpersonal process where both the nurse and the patient grow and learn. Throughout the video, the narrator describes how Paplou emphasized communication, trust, and active patient involvement. The video outlines the 4 phases of the nurse-patient relationship, showing how the relationship begins with the patient seeking help and progresses toward the patient's independence. Real-life examples demonstrate how nurses use listening, teaching, problem-solving, and emotional support to guide the patient toward better health outcome. Overall, the video shows that Paplou's theory is not just for psychiatric nursing. It applies to all clinical settings where communication and interpersonal relationships matter, including the emergency room, where you see the scene has taken place. The first phase of the theory is called the orientation phase. The patient expresses their needs, concerns, or problems. The nurse collects data, establishes trust, and explains the roles. The goal in this first phase is to build a foundation of trust and identify the patient's problem. Phase 2 of the theory is the identification phase. The patient begins to work with the nurse and feels understood. The patient identifies with helping the relationship. The nurse encourages autonomy and supports the patient in setting goals. They define the plan of care together. 3, the exploitation phase. The patient fully uses available resources. Teaching and support. The nurse provides interventions, therapeutic communication, and education. The goal in this phase is to maximize the patient's use of a nurse's expertise and resource. The final phase is the resolution phase. The patient's needs have been met. The therapeutic relationship ends appropriately. The patient feels better, moves towards independence and self-management. The goal in this phase is to ensure a healthy and professional termination of the relationship. You can see at the end of this video, the patient feels better with Nurse Sarah. The patient is able to breathe more independently. The patient feels comfortable in their setting.